A big thank you and shout out to Aaron Whalen of Compassionate Coaching. I'm so grateful to know you and so grateful that you invited me to this Meaningful Moments Dementia Conference. I'm also always inspired by your playback theater team, and I'm also inspired by the amazing practitioners and caregivers and advocates I met at this conference. Every conversation expanded my understanding of how to better support individuals living with memory loss or cognitive change or decline. And I'm committed to growing so that I can better serve my clients, my families or their families, my family as well, and myself. I hope you all enjoy this short video. I hope there's something here that supports you, inspires you, and encourages you to take the time to learn more about dementia and memory care.
And so what you're describing is something called delirium on top of the dementia. Yep. Delirium is reversible. Delirium requires an intervention or even a removal of a medication in order to see who this person is. Dementia is a chronic, irreversible, progressive disease. And so what you described was delirium. So mom has dementia, and then on top of that, unfortunately, mom had urinary tract infections, which can give you a dementia presentation. It requires antibiotics oftentimes, it requires increasing fluids, even the introduction of the IV fluids, the supplemental oxygen, as well as the blood transfusions. All are temporary interventions. And so oftentimes we as a community in general, being patients and loving the people that we love, see this as the resolution, when in many cases in healthcare, it's a Band-Aid. And so how long can mom stay in the hospital? How many blood transfusions can her body endure? Because blood transfusions come with side effects. Everything you put in and out of our body comes with some degree of a side effect. There's an aversion side effect, not even an allergy, but the nausea, the vomiting, the fluid overload, the infection potential as well. And then even antibiotics that are introduced in our lives. The first question that I ask is when families who are receiving hospice care ask about an antibiotic. Well, mom always gets this antibiotic, or dad always gets this antibiotic, but she can't swallow, right? So then now I'm inserting a catheter in her rectum in order to give her antibiotics. The question that I then ask is, where is the quality and where is the comfort in this? And it's not that the goal is to stop, because end-of-life care does not mean do not treat. What we are advocating for is, where is the quality, where is the compassion, where is the comfort? And even though there is an intervention that is there for you, is it for you? Because not everything is for everyone. And so in my earlier days, I'm only 18, but in my earlier days, I led a nephrology practice for people who had end-stage renal disease, transplant patients who failed. Dialysis is for everyone. Dialysis is like running a marathon 3 times a week. So you get your treatment on Monday, you ran your marathon, you try to recover Tuesday, then you have to go back again on Wednesday. Then you recover on Thursday, back again on Friday. And then you have a little bit of reprieve and back again. So yes, there's an intervention because now I've introduced this treatment that serves as a substitute for my kidney. However, to endure this forever brings about a sense of not comfort. And so when I say I applaud you, I will never stop applauding. I'm so proud of you for saying, have you considered doctor? And sitting in the shoes as a doctor, we don't know everything. We don't know everything even about ourselves. We are the worst patients. And so if we encounter a clinician, a doctor, a healthcare professional that doesn't listen, move on. And if anyone becomes offended by anybody asking a question about themselves or someone they love, move on. We move on without hesitation. I would find another person who will listen to me and hear my heart. Because the only way that we can align ourselves as clinicians with families is if we align ourselves and we get off of our pedestal of I know more than you. I just happen to be in school longer. Why, I don't know. But I did it. Do you understand what I mean? But it doesn't mean that I'm better than, I know better than. Because at the end of the day, as I share with families, you love your mom, dad, uncle, brother, sister more than I ever could. And I am honored to be allowed into your life and in your home. And if someone doesn't respect that or give you that honor or grace, move on.
Describe the journey of dementia from your unique perspective. I won't just work our way down this way.
Scavenger hunt.
For me, ever changing.
Challenging with grace. That's good.
I would say evolutionary.
Leave it to the preacher to think of a song. I would say joy and pain.
That's awesome. Present. In what ways does dementia intersect with other health disparities in aging populations? And whoever wants to jump in and handle that?
I can go.
Yes, sir.
So as a hospice physician and internist, I work very closely with end-of-life care. Dementia most resembles or intersects with cancer diagnoses for me, from the standpoint of the knowledge base and also the uphill battle that not only patients but their loved ones have to face. I use the word scavenger hunt because no 2 days are the same, no 1 hour is the same. And the way that someone, whether it's a patient or the caregiver, navigates the healthcare system along with the illness that they see on a day-to-day basis, it is troubling at best, and it requires a significant stronghold. The information is there. The question is it accessible? And have we strengthened ourselves to lean into the information so that we can empower ourselves? It's key.
So as a follow-up to that, what is the biggest challenge for you in bridging that gap?
Education, explanation, and receptivity. Sometimes, and I think it was echoed very well in the screening, sometimes, I would say actually oftentimes, it's the lack of desire to know what is actually happening and navigating blindly in an arena and an atmosphere that is overwhelming with information. And so, as a physician, I'm not the enemy, nor am I the person who knows everything. And so, the desire that I have in the people that I care for is, let's walk together with this journey. Don't allow me to be in front. Don't allow yourself to be behind. It is you in the center, frontmost, important throughout all of this.
About scavenger hunts. I am a daughter and I'm a care provider. My mom is 82 years old and she has vascular dementia. And we're from Kansas originally. I've been in the DC area for over 30 years and I had to move my mom here so she could age in place in my home. And it has been a scavenger hunt because after her diagnosis, she had 9 mini strokes. And I didn't know really what that meant. The doctor said, okay, here's the diagnosis. She's got this. And then I felt like I was on my own. So I am researching, I'm Googling, I'm doing everything that I possibly can because nobody is telling you about the day-to-day journey. They're not telling you that, one day she might remember this or she may not be able to use the phone anymore. And so I felt like I was alone, grasping at straws, trying to figure out what to do in navigating a clinical situation, and we're living in a home She may forget to walk. I have stairs. So it's been an evolution, and it has been a scavenger hunt. Because although the doctor was there to give me the diagnosis, nobody told me what else to do.
I appreciate the complexity of your journey.
Thank you.
And I know that it's one that's done with grace and with love. There was a book a number of years back called The 36-Hour Day. And I think many people who are trying to be caregivers really do see it as such, because they can't sleep because they're dealing with a person who may be wandering or may have explosive episodes or have other issues. They can't deal with a job in the same way that other people might be able to. And there, as I often say, there's a reason why sleep deprivation is in the Geneva Convention. It is cruel and unusual to not be able to get enough rest so that you can adequately take care of yourself, as well as take care of that loved one. The point that you're making with respect to why it is a scavenger hunt is it's very important, and the average person doesn't recognize that importance, often because they don't see anything outside of, I just got to get mama to her appointments, and I got to get her something to eat, and she's saying that nobody's fed her, but she's had 5 meals already. Right. And how are we going to do these things? And these are really hard. And so, whether it doesn't matter necessarily what form of dementia we're talking about, we're still talking about that loss of recognition, the loss that you might have been the favorite child, but they don't know it. Maybe you don't know it either because of what you want to say or do. But those are debilitating issues for which you still must find the words I used, grace earlier, because you need that grace too.
Story. Now just imagine pastoring a family that's been in your church, and maybe the loved one was an officer or a deacon or a deaconess, and the family is trying to cope with someone who maybe have been the rock of the family, now having dementia, some variation of it, some intensity of it. And I so appreciated in the screening this notion of the altar program, and I hope to learn more information about that myself. I'll just be honest, and I've talked to other colleagues, we feel ill-equipped even to help the family, because you have different levels of it. You have, let's say, a husband and a wife, and the husband is trying to do it on his own because it's his wife and he thinks he should take care of it, but we know that he really is not equipped to take care of her and him. She's coming to church, and this is perhaps a woman that was always together. Everything was nice, and you're noticing as the pastor and choir members and others, the lipstick is not on. Just things like that, and you know what's going on. And it kind of getting back to a sort of a resistance and receptivity. Hey, let us help you do. Oh no, I got it, pastor. I have this. And you try to talk to the children. Oh, well, my dad won't. So it's. I think when we talk about the Black church, and I love the treatment of the Black church and the screening, how important it has been in the Black family, and remains in many instances that way. As pastors and leaders in the church, we are ill-equipped to even help to support the family as they deal with this sort of, it's just a disorienting kind of thing all the way around for the person who has dementia, for the family, but for their larger community that they've been a part of. People just don't know what to do, what to say, and how to help. And it's hard to see. The lady in the room said it's one thing for someone to pass. It's another thing to lose someone and walking around you. And I know in our church community I get emotional when I think about it. We've had people that were watching them be lost. And we're going to really help the family.
Navigating, that's the roadmap as opposed to the scavenger hunt. You're navigating.
There's something to be said about that navigation, and there's something to be said about empowerment. And oftentimes we give our power away to the disease, we give our power away to the healthcare system, we give our power away to clinicians, we give our power away to everyone. But we don't give it to ourselves. And so all of this information, the goal is that it just oozes inside of us, so that when you do encounter and when you do observe and when you are continuing, you ask more questions to be empowered to make the decision that fits you and your family. Don't let the decision happen to you.
Yes.
And it is very important for us to not feel like we can't ask a question or be vulnerable because of what's expected.
So we have a lot of facets dealing with our community. I was talking with my sister about financial literacy and how it should be taught in our schools. Elder care should also be taught to young people. There was a time when the family was more integrated. You had grandma in the house. You had everyone in the same domicile. So you weren't missing that. Now everybody has to have their own space. So you're missing that part where the child sees through everyday living how we care for our own. And historically, we were not putting our parents in homes, whether one, it was a cultural thing, it was a religious thing, and it was also a financial thing. And so that was not an option to throw grandma away. And not saying throw grandma away, because when you get to a point where it is beyond you, it is beyond you. So I will add, when I was, and my daughter's over there, when I was her age, I was helping to care for my grandmother. I would get calls from work. I would have to go home and take my grandmother off the floor and different things like that. More recently, I was caregiving for my aunt and my mother simultaneously. That was a 10-year, I say a big, it was a 10-year run, and it was a blessing. And people are always saying, oh, God is gonna bless you, but when you're in it, and you don't see the forest for the trees, and these two people who raised you have entrusted the rest of their existence to you. I would go, and my mother was a sweetheart. She just passed in May. My aunt passed 2 years ago. Haven't grieved yet. Haven't had an opportunity to grieve yet. And tried to do everything on the front end so there would be no guilt on the back end.
Yeah.
That was the thing. But my aunt was feisty. You know, I get a call from the facility. You had to send your aunt to the emergency room. I go to the ER. I used to line of nurses and doctors holding themselves because they've been bitten. They're wanting to ward everybody out. And I'm walking into this. Like, how do I smooth this over? Well, Jay will take care of it. I don't know what I'm doing. I've been an artist 10 years. I don't know what I'm doing. I do sculpture and hope it works. You know what I'm saying? So gathering the information, and it doesn't happen by osmosis. You have to seek it.
Yeah.
You have to challenge your doctors when your gut tells you something is different. My aunt had a diagnosis of Parkinson's. I was like, this ain't Parkinson's. She doesn't drink water. She's perpetually dehydrated. There's some other things that are tying into this that you're getting a paycheck for. So when you talk traditionally, if you're an African American family, seeking an African American doctor doesn't necessarily mean that person that, skin folks is kin folks, but you have a better shot when you know that Western medicine and American Western medicine has typically used us as guinea pigs.
Yes.
So, you start talking about Henrietta Lacks, you start talking about Tuskegee, you start talking about medical apartheid, Harriet Washington, which is a phenomenal piece, and I read that when it came out years ago. But our aversion to that is based in something very real. So once you start grabbing at all these different pieces and then putting them together within your framework, with the church, with your medical practitioners, with your family members, because I've seen people, I'm the only child. I've seen people with multiple siblings, and it ends up being one sibling that takes the load.
Or a court case.
Yeah.
So, you know, in the admin part, how you're taking over someone else's bills. So I've been kind of doing the juggle with that as well. So there are a lot of factors that come into this, but I think once you become an active learner in this realm, find your support systems, and you walk, and you move forward every day, whatever it is. You know, might be slow, might be tough, but you know, if you can keep forward, I think that's a start.